something that I really enjoy.
I've worked on the stroke unit for 18 months. I've been here since I qualified from my nursing degree from Anglo-Ruskin University. So I started to join the stroke unit because as a student I had a placement here which I really enjoyed. I learnt a lot in such a small time of being here. I like the fact that it's acute medicine, but you've also got variety that you can work on the acute side and also rotate to rehab. So you see the journey that the patients go on while they're here and all the multidisciplinary team that go into one patient's care. I enjoy working at Southend. One, it's a really nice area. There's lots of activities you can do around Southend seafront. You've got Leon Sea, really lovely place to live. But also about the hospital, because it being a university hospital, there's lots of courses that you can go on in the education centre. You can learn more and develop your career. In the 18 months I've been here, I've done quite a few courses. I've done my cannulation, my blood training, my ILS training, all in the education centre, and I've got more to come as well. My role as a staff nurse on the ward, it includes many day-to-day tasks, what most nurses do, drug rounds. However, I think the more that I like is the acuteness of our patients that come in on their cardiac monitors. You get to pick up a lot of skills working with the cardiac monitors. We also have quite complex discharges, so we work as a part of a very dynamic team. We're involved in meetings where we're discussing our patients' discharges and the complex care that they need to go into that to make it successful. Maximise their potential recovery, really. The most satisfying aspect from the job is, I suppose, our patients themselves, seeing them on that road to recovery, sometimes quicker than others. But recently we've had a patient on the acute side, they couldn't walk, and they went to the rehab side, and just today I've seen them walking along the ward. And it is quite satisfying when you see that the patients, you know, they've come in not being able to do very much for themselves and now they're walking and talking very well. An example, we had a patient who was admitted, they'd lost all their speech, was unable to communicate. I then saw him a week or so later, and with the rehab that they'd had, I was able to have a conversation with them, and the satisfaction that gave me, but also the patient recognising me from when they come in. It's like, yeah, I'm talking, yeah, that they're really happy. That's really nice to see. I am excited about the HASU going into full swing. I think it means we are providing that excellence care, and it is worldwide class, really, from the National Stroke Strategy. For me, being early on in my career, it's good that I'll be able to learn and progress within the team, hopefully plan to specialise. But for the community as well, having such a specialised unit in the Southend Hospital, it will be covered and be recognised around Essex, and it will be able to provide that high standard of care to much wider community than what we are already.